And this week, I've been sent information about the NHS because I keep talking about it. People are sending me information about it. And something that's really shocked me is the way that it's being privatized slowly under the radar. We can't even really notice it because it's being done one by one. I mean, GP practices are the latest on this. If we look at this story here from a Lancashire, I think it's a Lancashire Evening Post, it's Chorley GPs fight to save practice from private company takeover. This is about a GP practice in Lancashire where a private company has won the tender over the GP who is loved by most of the community. Now we've got someone on the call who was a doctor at that practice before she retired, I think, and is now a councillor and is leading the campaign in a sense to keep that GP practice in the right hands. Margaret France, how are you doing, Margaret?
Hi, good morning. Thank you. Yes, I'm very well. And
now, I probably haven't given it much justice to the background to this, but the fact is that you have a GP practice with a well-loved GP. Because of a fallout between her and another partner, the whole practice had to go out to tender by this commissioning care group, CCG. But patients were not told that this would have any impact on the service or who was running the practice. And I'm just going to show people this letter that you sent me. This is the only information that patients were given about their practice being effectively moved out to tender. It says this will have it's just, we're right to inform you, a slight change to the running of Withnell Health Centre. The health centre was previously run by Dr. Anne Robinson and Dr. Mahad Siddiqui as a partnership. The partnership recently ended, and so a new contract needed to be issued. It just says that there's no, there should be, it's underlined here, there should be very little or no impact on patients as a result of this change. So there was no consultation on this. And can you tell us what's happened since that letter?
Yes, that's the story in a nutshell. This is a lovely rural practice on the outskirts of Chorley. 5,600 patients, and as you rightly say, the partnership was dissolved in December 2021 when the administration of general practices was then run by the clinical commissioning groups. So under the rules that then applied in the Health and Social Care Act, that meant that the partnership had to be put out to tender. So the clinical commissioning group produced that letter on behalf of the practice, and it was sent out to patients. But the letter itself doesn't comply with the Equality Act. There are no offers of that letter in anything other than English. There is no braille or audio version of it. So it does not allow any participation by people of protected characteristics. So that's one point. The letter itself, as you rightly say, is very reassuring that there is only a slight change. Well, actually, no, that the partnership was being put out to tender, and under the Health and Social Care Act, quote, any willing provider can offer a tender. So that the tenders were received, were anonymised, were sent out to another area to be scored on a basic scoring system, and then nothing further was heard at all by staff or by patients until the 16th of December, at which time a letter arrived on Dr. Robinson's desk to tell her that she wasn't the winning bid of the contract, and that the contract would go to an organisation called SSP Health, which currently runs just short of 40 general practices across the north of England. And that was a great shock, as you can imagine. It was made even worse by the fact that basically the doctors and staff of the health centre were given a gagging order that they weren't to speak about this, for a period of 30 days, which is called a standstill period, at the end of which the contract would be signed. So that in effect meant that not only was she not going to be able to continue to run the practice, but was paralysed from being able to tell anybody or do anything about it. Now, fortunately, a member of staff saw that letter on her desk and leaked it via Facebook, and I'm very glad that she did, because otherwise, by the time anyone knew, it would have been too late to do anything about it. So Dr. Anne Robinson immediately asked for an appeal against the decision, and they gave her 10 days to submit an appeal, bearing in mind this is the 16th of December. She successfully managed to get that period of time prolonged a little bit, but it still was a short time to submit an appeal against this process, which in my view is very slanted towards bigger organisations because of the number of points it allocates to things like IT systems, renewals, and HR departments. When you run a small practice with a staff of maybe 8 to 10 staff, a lot of whom are part-time, you don't really need an HR department. So it does seem to have, it's skewed towards larger organisations who can afford to bring in a consultant to produce a beautiful document promising everything under the sun in order to score maximum points, dot all the I's, cross all the T's, win the contracts. And this is what's been happening. So as soon as the community were aware, given this is a small community, but I think a very cohesive community, and they're all behind Dr. Robinson in her practice here. And 1,500 letters and emails were sent to the Integrated Care Board to tell them that they were not happy with this decision and that they needed to revisit it. I should say that during the course of the tendering process, there was a massive reorganisation of the NHS in 2022. So what was the clinical commissioning group at the beginning of this process changed into the Integrated Care Board on the 1st of July. The Integrated Care Boards are really quite new organisations, and they seem to have massive powers, including their own self-regulation. For instance, they actually had the power to dismiss Dr. Robinson's appeal unheard because they said that they had followed their own protocols. Now, I don't know any other public body that can dismiss an appeal against it without hearing that appeal. Surely that should go out to someone else to make that decision. So that left her in a really impossible situation whereby the only recourse she had was to go to judicial review. Now, by this time, she'd spent £35,000 of her own savings on fees for solicitors and barristers to get to this point. And as I say, to produce this appeal that wasn't even heard. So you can imagine a barrister advised her it could be a six-figure sum if it went to judicial review. So at that point, she pulled out. So the patients really got behind her. We had a demonstration outside the surgery. Members of the ICB came to visit the surgery and talk about what was happening. And then the following week, there happened to be one of the regular board meetings locally. So another group of patients turned up outside the board meeting. And to be fair, they took 20 representatives into a room before their board meeting, sat down with us and listened to what we had to say. So I do feel there's a little bit of movement at this moment in time. They're starting to listen to the idea that maybe this was not the right decision to make for this practice. If I can just quote you some figures, because I think they're very telling, and these are all in the public domain, you can check these. It's the result of the 2022 GP Patient Satisfaction Survey. Now, Withnell Health Centre, which is the place we're discussing, can you believe that the score for the satisfaction with the GP appointments offered, in other words, how long you have to wait for a GP appointment, that was 92% at Withnell Health Centre against a sort of national average of 72%. So they're well above, because we offer same-day appointments. It's virtually unheard of these days. Two nearby practices run by this other organisation, SSP Health, Shanty Medical Health Centre's satisfaction with appointments offered was 23%.
Wow.
Bolton Medical Centre satisfaction with appointments offered 42%. And we're looking at 92% at the moment. So how can this be an appropriate decision? Because in my opinion, we're changing something which is a very high quality service, very individualized, to something that is just going to be run purely for profit.
Yeah. Well, thank you, Margaret. I mean, this Withnell campaign is central. It seems pivotal to the future. I think if people can look it up and show support and retweet and share and stuff like that, then it might be a big help in the future for everyone else, because it seems to be done one practice by one practice. I'm just going to bring on Dr. Bob Gill, because I'd like to hear what he's got to say about the national situation. How are you doing, Bob?
Hi, Crispin. Fine, thank you.
Thanks for coming on. So what Margaret's described in detail about this particular surgery, can you tell us how many other practices are experiencing this putting out to tender and then being taken over by private companies?
Yeah, so we have the example in London of a company called Centene, which I believe is now the biggest provider of primary care in England. They were the subject of a Panorama documentary, which outlined how the services have slipped and become very poor, because in order to maximize profit, you want to avoid sick patients, drive them away by providing a poor service, employ the cheapest number of staff, the lowest qualified staff, and erect barriers to access. That's how you make money. That's the business model. What they're providing in Chorley is high standards of care by people who know the population, people who have a sense of professional duty and ethics. Now that is not the business profitable model that they're copying. So a lot of what's happening in general practice is happening very quietly. We have a recruitment problem where, let's say, if you have a single-handed practice, they can't recruit a successor, so they give up their list, and that list gets swallowed up by neighboring practices. But the key thing I think we need to realize is that ICB, that new quango, has not just made an error of judgment. This is government policy. You have to understand that the future of general practice is not one led by GPs who know their patients. The future of general practice is big corporations, big practices, remote from their patients, greater traveling distance, and poorer quality care. And what was also tucked away in the 2022 Act was that they will be bringing in perverse incentives for your healthcare provider, your primary care provider, to deny patients care. That is the end game. Now, you found out with the Withnell practice that these ICBs have a lot of autonomy. That's no accident either. They are new public-private entities which are divorced from democratic accountability. But this has a long gestation. Remember, in the Blair-Brown years, they abolished local accountability. They abolished these organizations which said, whatever you do, whatever restructure you do, you have to have consultation. Well, that's been got rid of. So these ICBs are inherently undemocratic. The leaderships are tone deaf to the needs of the population, because their position on these boards depends on them going along with it. And the reason they're belatedly listening is because you've had such a successful campaign. The population isn't going to put up with it. But if you have other populations in inner cities where it's more deprivation, less organized, less motivated, don't have the skills, not so eloquent, not so organized, and do not have a passionate GP who's prepared to fight, they will quietly be killed off, those practices. So this is a wake-up call for everybody. And I do hope people stop framing this as some sort of error or incompetence. This is deliberate. This is the direction of travel. This is the policy intent to smash general practice as we know it, to get rid of that longitudinal continuity of care, and make general practice like a conveyor belt where you never see the same doctor twice. You might not even get to see a doctor, and you might not even get access to your surgery. It will all be online because it's cheaper.
Wow. And just to finally, Bob, the Labour Party has not mentioned this at all, as far as I can see. Wes Streeting and Keir Starmer haven't said anything about this. Is that something you think's deliberate? I mean, they seem to attack GPs, don't they, at the moment?
Yeah. So again, we have a one-party state. We have a neoliberal party state. A little history lesson: 2004, we saw the biggest upheaval. That was the Labour Party. 2004, a new GP contract which privatized out-of-hours care and created a two-tier system of partner GPs and salaried GPs. And for the first time ever, people like Richard Branson or Centene or SSP could bid to run a practice. You no longer had to be a doctor to run a practice. And the other thing they did, very importantly, they decoupled GP income from having to see patients. Let me say that again. You could earn an income by being a GP and not seeing patients.
Wow.
And how do you do that? What you do is you outsource the provision of care. So the entrepreneurial GPs, the GPs that sold out to Centene, went round hoovering up neighboring practices, not providing care themselves, employing cheaper staff. We do not have a moral leg to stand on now that these companies have come in and doing exactly the same, because New Labour laid the foundations for what is currently going on, and they're hardly going to criticize it because that's what they want to happen as well.
Wow. Well, thank you, Bob, and thank you, Margaret. Margaret, if you could put stuff in the chat about anything you want people to sign, petitions or anything like that, do so, and we'll follow that. Thank you.
Can I come back 1 second?
Sure.
Is that possible? I just wanted to say that the one glimmer of light, I think, is that as of the 1st of January this year, the amendments to the Health and Care Act now mean that the dissolution of a practice does not now automatically trigger a tendering process. That is now possible if the current partnership is providing a good standard of service. There is no need for this to be put out to tender. And to my mind, I think that is a big step forwards, because it will help to preserve what basically is the jewel in the crown of the NHS. The GP service that we have, when you have a very good standard of care, as we have here in Withnell, it's the gatekeeper of all the NHS services. If I can just say that our practice here in Withnell has the lowest attendance in emergency departments and urgent care from the entire area around us, which is all of Chorley and Preston. The reason being that people get same-day appointments when they need to be seen, they're seen. So that chest infection gets treated before it becomes a pneumonia 10 days later and a hospital admission. So the message is very clear. The only way to solve some of the current issues with hospital capacity and everything else is to support general practice, because it is absolutely the mainstay of the NHS in this country. Thank you.